So, Namaskar everyone, and I'm Dr. Manish here, and back to my channel again. And this session that we are going to record, it is the extension of Bogers Approach. We had one introductory lecture, and after that, we had talked about summarize the methodology. And in this session, and one more coming session, we are going to talk about some cases from Boger's history, like some cases where Boger has done some work. Practically, if you want to understand any philosophy, it is always good to go and see their cases, the way they practice, the rubrics, the understanding, mathematica that they matched. So in this search of Boger's cases, there are two videos I'm going to record. One video is about liver cases. I'll be showing you two liver cases, and then a clinical case where some other cases I'll be sharing with you. So let us go directly to the our PPT. So Boger synoptic key. Now, whenever we are talking about Boger synoptic key as a repertory here, we're going to talk about in mathematica. And Boger synoptic repertory was written by Boger, definitely. The extended version, the bigger version is BBCR actually. So Boger, who based his entire philosophy on Bonninghausen's ideology, he took Bonninghausen's antipsoric and other repertories, he combined and added his own general symptoms, taking Kantinian view, the structure of it. So generally, a lot of people, like even I also use a lot BBCR in my practice because it is very handy and very useful and more search is there. But yes, Boger Synoptic Key is also one of the book that we should keep in our mind, and in some cases it can definitely be of great help. So I'll be sharing you two cases here, and these cases are liver cases. Uh, it was treated by Boger. From where I got these cases, I got these cases from this book. Now, again, this is the third book which I am going to introduce here, Shashikant Tiwari. And as I told you, when I was looking for Boger's understanding, and I have collected many of the other resources. So initially, if you see introduction, I talked about Dr. Rashid Akhtar's videos. In section methodology, Boger, I shared with you a book by Legacy for Boger by Dr. Singhal. And here there's another book, very beautiful, very nice book to give you a major understanding about Boger's principle and practice is Shashikant Tiwari's book. So in this book, there is one chapter on liver cases and clinical cases. So I read those cases. And when I read those cases, of course, the case is given, understanding little bit is given, and of course, the remedy prescribed is given. I started thinking myself because this is the way I learned. I have learned Burnett also this way and other. Whenever I get any old literature, old cases especially, I want to know the thinking process of it. So I started thinking backwards that if this case was there, of course, I know now the remedy, this is given, but how did Boger came to this remedy? Or if this patient comes to me, then what is the approach? How should we go ahead? So retrospectively, I've tried to study those cases, and I'm trying my best to give you a platform where we can learn from these cases. Everybody should go and get old cases, retrospectively learn, because in this method, what happens is that your knowledge of repertory and mathematica increases a lot. So this is a very interesting study. Okay, so I'll be sharing you the way I have done it, and let's see how it goes. So case one, 10 months ago, a professional man came to me with following history. The history goes like this. 25 years ago, he worked in cistern. This gave him severe cold, followed in turn chill and fever. After which the following chronic symptoms gradually developed and have been with him in increasing intensity ever since. So this is how the case came. So case comes, some liver complaint, of course he has. But how the case starts is 25 years ago, he worked in a cistern. What is cistern? I'll show you. It is a water tank, basically, where big water tank where you go and work inside. So he was exposed to dampness. Something happened there. He was working there, and after that, he got fever, cold, cough. And after that, the chronic symptoms are gradually means he is no, increasing. Means he's never well since working in cistern. You can take like that. What is the trouble now? Skin of face yellowish, dry, lips are dry, feel parched. Means right now he's having jaundice. His liver is affected. He's having jaundice and other complaints. Weak feeling of upper lip, right side of tongue, aggravation when he is flatulent, burning across forehead. Wheat, bread, starch, water distress him and turns sour. He belches up sour food. Eating is soon followed by depression. Always light colored stool. So when you see these symptoms, right? Wheat, bread, starch, water, it is distress, turns into sour, lot of belching, eating is aggravating, stool is light colored, there is some yellowness on the face. This all give you understanding that he's suffering from liver affection, probably jaundice he's having, and liver is inflamed, liver is congested. Other symptoms were water taste, flat tongue is coated in morning especially. Soreness above. Now see, soreness above and to left of the navel. It's very interesting. Just listen to what is there and then we'll analyze. Soreness above and to left of the navel. Rainy or hot weather disagrees. Lassitude, depression in the evening. Occasional migraine at 9 to 10 p.m. Prefers to lie on the left side. Urinous order of the sweat. That's the case. When you look at this, I hope you remember this diagram, right? This is the diagram that we have discussed. So when you want to think in terms of Boger's approach or in any approach, this is how these are the 5 pointers that you should look for. First is modality. So when we talk about modality, in modality comes first is causation. Causation means cause and course of illness. How did it begin? How did it start? What is the source? What happened? So not today patient is coming for jaundice, but his case is being deteriorating since he worked in the cistern. So we have to understand what happened there, what he was exposed. If it would be great if we can get the exact fever symptoms and fever chill symptoms of that time. But many times it is very, very, very difficult. Time, temperature. Ah. Modality. So first is modality. In that causation and other aggravating and ameliorating factor. Second is mind, then our sensation, subjective symptoms, objective symptoms, and then parts affected. Will you get all of that in one case? If you get, probably very good. But maybe in many times something is prominent, some other things are not. So whatever best out of this 5 you can get, short symptom you should take and go ahead with that. So let us see. Analysis. Ailments from, first is ailments from. So he worked in a cistern, right? From there, he was exposed. He got fever, cold, whatever. That might be got better. But after that, his disease, he's being suffering. So ailments from working in dampness. Cistern is a, I told you, it's a big water tank where you're working inside. So a lot of dampness is there. So he was exposed to a lot of dampness. So first, you have to find the ailments from in this case. Second is location. Okay, now the patient has come. What are the areas that is being affected? Okay, the local parts. If there are certain subjective sensations, modalities, of course, ailments from. What is ailments from? Working in cistern. What is cistern? A container for storing 25, storing, what I was saying 25 is, just imagine, 25 years he was exposed. From there, his health is deteriorating. If you have heard my earlier lecture on the course of illness, sickness, this is what I was trying to explain you, that course of illness. Today, patient has come, but since when he is being troubled? So go in the past, and he will tell you the first attack happened here. First time I got fever, cold, headache, diarrhea, and since then my health is being deteriorating. So that has to be considered, maybe in a ailment form or maybe in a totality form. So container for storing water, especially one that is connected to a toilet. This is how it is. You see, he was working there inside that. So this is dampness basically. So how he took, so when you work in that area for a long time, you are exposed. So dampness is there. So the first rubric about ailments from Boger. Conditions, dampness aggravates. Generalize. The concept is to generalize. So conditions, aggravation, dampness. If you see in this rubric, condition, dampness, aggravate is getting wet, wet weather, bathing, working in water or damp. So any form you are exposed to water, you can take this rubric. 28 remedies are there. So first rubric is this. Let's talk about location and sensation in this case. So definitely liver is affected. How do we know? Abdomen and stomach symptoms are there, which suggests liver is affected. Liver and gallbladder both, because digestion is a problem. What else? So indigestion, whatever indigestion he is having, these are symptoms, these are reflex symptoms and organ affected is liver actually. Now reflex symptom has to be understood. I have made a video on reflex symptoms. You can go and watch it maybe later on. See, many times patient comes and talks about his symptoms. I'm having burping, I'm having headache, I'm having nausea. And what we do is that we take those rubrics. Okay, nausea, eating after, headache, pain, this, that. But we never think that what is the seat of action, like Burnett says, a seat of action. From where this trouble is, like in this body, which organ is actually damaged. So when you put in a search, you can just do this exercise, just put reflex. You'll find reflex from uterine diseases, reflex from liver diseases, reflex from, so many other areas. Migraine is one of the thing, like I have struggled a lot with migraine patients, a lot. And I used to give remedies, nothing used to happen. Like sometimes they're better, then again it comes back. So lately, last few years, I understood that whenever I'm treating migraine, maybe I'm treating superficial things, symptoms. I have to find out what is affected. And majorly, I found out that liver is affected. The patient is constipated, burping is there, acidity is there, irritation is there, pain is there, stools are not formed. What does that mean? Liver. When liver is affected, gallbladder is affected, and the reflex symptom is headache. So when I take only headache totality and prescribing, it will work, but it is partial. So this is how you understand organ affected. Stool color also suggests organ affected, that liver and gallbladder affected. So liver and gallbladder is affected. So organ affected is the location. Sensation or indigestion system symptoms don't look as it is reflex. So if you take reflex symptom, the meaning is if you take these reflex symptoms and repertorize, you'll get the remedy which is superficial remedy to the case. So find out the organ affected. So rubric goes like this. Boger's stomach and abdomen, hypochondria, gallbladder, gallstone. So in this, everything comes. So hypochondria, gallbladder, gallstone, all the things. The entire area is your location. What are the reflex symptoms here? Burning across upper forehead. This is a reflex symptom, superficial. Underlying organ is liver. So following would be appropriate remedy, appropriate rubric. No? You can take this. Now it is not there. I was looking for location, like not only organ, but body location also. This patient has pain in the forehead. Now why there should be pain in the forehead? The pain could be in temple, vertex, somewhere. So in Boger, I couldn't find. I told you, Boger is limited. Bonninghausen, BBCR, Boger Bonninghausen repertory is extensive. So I wanted a rubric forehead because that's important. So I got it in Bonninghausen. Internal head, I just took location. Now burning, whether it is burning, whether it is stitching, itching, forget it. I just took location. And there is one beautiful rubric in Bonninghausen, not in Boger. Internal head aggravation with liver symptoms. So once you understand that this patient has headache, but his liver is congested, inflamed, affected. So this is the apt rubric other than taking burning in the forehead. This is like a concomitant, or this is like a modality, not concomitant, this is a modality, which takes consideration of the cause also. So internal head aggravation with liver symptoms. There's one more rubric. Internal head aggravation, digestive disturbances. So you can combine both. We can combine and make it one, the two ones, the liver and the digestive disturbance. What about the modality? Rainy weather and hot weather aggravates. Again, we see dampness aggravates. So rainy weather, hot weather, hot, but again rainy weather, dampness. There's something to do with dampness. Soreness is there above and left navel. Now this is very important. Soreness above and left navel. What does it suggest? Left navel. If you look at left navel above here, this part. No, let me show you this part. This part generally. Of course, that's why it is said in that methodology chapter when you read that he says last video which I talked about, examine, touch the patient, examine it, see the organs affected. Of course, now if he was my patient, I would have examined, I would have done sonography. Even if you examine and patient is constantly telling upper, above and left navel, what does this suggest? This suggests the organ affected is spleen. What is behind this? Spleen. So maybe spleen is enlarged. So in this patient, gallbladder, liver, and spleen is enlarged. So I need a remedy. Modality, the causation basically dampness, liver is affected, spleen is affected, right? So there's a rubric, Boger, stomach, abdomen. In Boger, hypochondria, left, spleen, and pancreas. And there's one modality also. Pain lying on the left side is the modality. If the patient lies on the left side, it aggravates. So the rubric is stomach, abdomen, liver, lying on the left side aggravates. So he wants to lie on the right side. So these are the rubrics. The dampness, hypochondriac, gallstone, gallbladder, spleen. So you see, modality, location, all these are location. These are concomitant. Again, location. There's again aggravation, liver, digestive deficit. So when you repertorize this, only this much. The remedy that you get is Bryonia, natrum sulf, cardamom, calcarea. Now what you do is that you read the remedy. You cannot just give. Like I shared this case to many of them, many of my friends. Many of them repertorized properly and they said natrum sulf is the good choice. Why? Because we know dampness aggravates. It's a liver remedy. Yeah, but there's another remedy, cardamom. Interesting, interesting. This is the beauty of Boger's approach, that you can get some very specific organ remedies also. So you can read all the remedies, but the remedy that was given here was cardamom. Cardamom was started in mother tincture and then to potency. Old symptoms to have come and gone. He's quite different man now. After first dose, he declared that he could feel the bile dropping from the bile ducts. I laughed at him. He had several mild attacks of gallstone. So it's a case of gallstone, liver, gallstone, everything affected. Color of stool, normal now. Something strange happened in the follow-up. On one occasion, remedy excited, head cold, relieved instantly by nosebleed. So what happened is that he got coldness of the head. It was relieved by nosebleed. This is strange, right? And another occasion, there was some small hemorrhoid recurred after 25 years and rapidly left after slight bleeding. So he had hemorrhoid, recurred, which was old symptom. It bleeded and then it disappeared. So bleeding ameliorates is actually a general feature of this remedy. Yeah. Cardesmer, when you read Cardesmer, it is written bleeding ameliorates because it works. One of the area is portal circulation. So see how body also reacts. Now you don't have to give remedy for this. He got head cold, nosebleed happened, he got better. Body takes care of it. Not all the time you have to prescribe. Hemorrhoid old symptom came, it bled, and then he got better. So when retrospectively you see condition bleeding ameliorates, there are only 10 remedies, and one of them is cardesmer. That's so nice of it. So check MM. You can go and read MM. Now, interesting fact here was the spleen rubric in Boger doesn't contain cardesmer. Now, this is very strange. I told you, right? The spleen is also affected. But when you take spleen rubric, I think I must have taken, yeah, I've taken this. Boger stomach spleen, arsenic, schionanthus, helionthus, calibi, polycanum, I think, ruta and squilla. That is why you have to take bigger repertoire now. That is why the Boger gets very limited synoptic king. So when you go in BBCR, maybe you'll have more remedies. But when you're talking about Boger generally, the spleen is not there. The patient, you might think, right? Spleen is not there. So we can check in MM and BBCR for reference. So when we check in MM, cardesmer, that's materia medica, liver, right, and spleen. Next organ is spleen. So you see, Boger synoptic ki materia medica, spleen is written, but maybe in the repertory part it is missing. Hence, I always say that repertory is just an index. Do not rely too much, whether any repertory it is. When you're repertorizing too much, rely too much on rubrics. Whatever you want to search the matching, real matching you want to make it. When your repertory gives a general remedies, 4, 5, 6 remedies, match it in the book, the materia medica. So when you go and you see in the book, you can check here, better by bleeding. It's one of the features. And the first line that is written is hepatohemorrhagic diathesis. So it is a remedy. It is a remedy for liver, gallstone, and so many other things. But it is hemorrhagic diathesis. So liver is affected and the blood vessels are also affected. So portal circulation, hemorrhoids, nose bleeding happening. Those are the features of this remedy. Right? So this is how I try to understand this. And I was really thrilled with it, right? I want to show you maybe, yeah, I think I can show you in Boric maybe. Yeah, let me show you something. So retrospectively, I started studying this and I found something interesting. We go to Cardis. What is written in Boric? The action of this drug is centered to liver and portal system, causing soreness, pain, and jaundice. Specific relation to vascular system. Specific relation. So vascular system will be affected. So liver, gallbladder, and portal system, but vessels are affected. Abuse of alcoholic. It is one of the wonder remedy for liver complaints, people who are absolutely alcoholic. Varicose veins. See what is written in bold, varicose veins. So liver complaint and varicose veins, you can think of this. Disease, now here, how beautiful it is. This is what I want to show you. Disease of minors associated with asthma. So natrum self, hydrogenate constitution with thing, dampness. So minors means it is damp, right? Damp. And they get asthma. So that's why this remedy act. So beautiful it is. So beautiful. Okay. So when you study a remedy in this fashion, I feel the repertory is nothing but it is always a tool. Artistically using repertory is very important. So patient can give you a lot of symptoms, but if you try to repertorize every symptom, you will be lost. You will be lost completely. So the idea is what? Idea is what? When he says, Boger says 5 points, he says Please look at locations also, look at organs also. Try to find out. This is what Burnett also was doing, and he called it organopathy. Same thing he did. Burnett used to say that give organopathic remedy. Now, with homeopaths, what happens? We tend to forget organs, and giving organopathic remedies is a big problem. Maybe we don't understand, our repertoire doesn't catch. Our repertoire will not catch because we are using big, sophisticated repertoires. You come back to the smaller ones. Take some smaller rubrics. Take some important symptoms. Use Boric, use Boger, BBCR. It will help you. This is how it goes, right? So this was a wonderful case, and for me, it was a great learning experience. I learned so many things. I don't know if he really repertorized like this. This is what I have done it retrospectively, thinking because I knew the remedy, I knew the case. I started thinking, how can we repertorize this? So what I learned here is all the rubrics. I learned about the organ, how to take. So maybe I not use bogus, I not take repertory, but I will use BBCR and then dampness wala rubric. That was amazing. Let's have another case, a short case. So case number 2. This is again a case of gallstone. Woman had several attacks of gallstone, asking for relief, giving the following symptoms. Soreness, aching, as of something in liver, with aching below scapula in the heels and in the heels. So there was aching in the scapula, below the scapula and in the heels and also in the liver. Was lying on the right side. So right side when she's lying, aggravating. Our last patient was left side, okay, aggravation. And stooping, whenever stooping, they're aggravating. Burning in gallbladder and soles of feet in the night. Standing hurts the soul. Eructates much gas on first rising in AM. There's a lot of eructation. Now you understand, right? Eructation and all these rubrics you will not take because once the liver is affected, these are all common symptoms of the disease. So don't take those symptoms. Vertigo felt in vertex. Now this is very interesting. Aggravation reading, rising up, jarring from stepping hard with drowsiness. So this is interesting. And I was thinking, how can a patient tell you that I got vertigo felt in vertex? I don't know. I don't know how patient will describe that. But I have interpreted it, try to understand is the patient will come and tell you, I get vertigo and something heavy, some sensation here in my head or vertex. Then you can take that during vertigo, something happens here in the vertex. So vertigo felt in vertex. Now it is the vertigo is aggravated by reading, rising up from stepping on hard. And what is written there? With drowsiness. So along with vertigo, there is a lot of drowsiness. Drowsiness. This is what? This is concomitant symptom. This is also part of the modality chapter. Okay. The number one, the first paragraph. So vertigo with drowsiness. Very important. Impatient, aggravation, noise, stooping, standing, starchy food. Starchy food again means liver is affected. Emulation, open air. So what are the rubrics now? So rubric is Boger, right? Liver, gallbladder. Okay. Liver sore sensitive because liver is sore and sensitive. Heel pain, right? So you don't have heel exactly. You can generalize and make it food. So we are taking the location food. Okay, we have heels also. Okay. So you take both because BBCR always talks about generalizing. So if you take heels, what is the problem here? Heels, there are 13 remedies. In food, there are 10. If you see both, you might have some remedies not in one rubric and another. So you can combine and make it one rubric here. Then you have another rubric, foot heals, pain. There are only 4 remedies. Now these rubrics which have got 3-4 remedies are very risky rubrics because if your remedy is not out of those 4 remedies, then you are lost. So ideally what I do is that I will take all the 3. I will take foot heals, heat pain and combine it. Here I have not combined and showed you, but maybe I might have done in my sheet. So combine and make it one. Less chance of missing. What are the other sensations? Foot soles burning. Conditions lying on the right side aggravates. Gallbladder, now gallbladder, so stooping aggravates. Only one remedy. Vortex felt in, vertigo felt in vortex. Vertigo motion aggravates. Condition noise aggravates. Air open ameliorates. So now this is very interesting. This is something is very contradictory to last what we did. And this you will learn something very nice here. So if you look at this, just look at these rubrics. Have I done justice to it? Of course, there are some rubrics, 2 remedies, 5 remedies. Of course, you can say I can go in maybe in BBCR and get metal, but I have taken everything, right? Location, modality, concomitant, everything I have taken. Now what happens here? This is my repertory sheet. Okay. Yeah, foot heals. You can see I have combined and made it 22 remedies. Now what to do? So difficult. So when I repertorize this, I said, my God, now which remedy should give? Because none of the remedy is having majority of symptoms covered together. Use Boger synoptic key to repertorize. When I use totality suggests no proper indicated remedy. Rather, it causes confusion. Now, what we can do is that we can go and start reading drugs in the sheet like rubrics, remedies which are there, predominant one, and with our mathematical knowledge, we can definitely differentiate. Or else use another repertory and make totality again, but the result is going to be rather same. How many times this happens to you? It has happened to me many times. Whatever structure is given, then location, sensation, modality, concomitant, the 5 step, when I do it properly also, many times such sheet comes in front of me, or maybe the remedy which is coming is not matching. Now, very important is that the remedy that you give has to match, not the rubrics or the totalities. Remember this. People always say totality has to match, totality has to match. No. Lot of homeopaths who show exact totality, I'm telling you, forefront, they use reverse repertory. They know the repertory, they go on reverse, they will get the rubrics and fit it and show you. And the student feels, wow, he is so great. His all remedies, his all rubrics are matching. And it doesn't happen in practice. So many times you take properly aligned philosophy, but still you will have maze like, confused repertory sheet. Or even if your remedy is not matching, so remedy has to match. Also, I'm using that this patient already suffered several attacks of, I'm assuming that, of course, gallstone, several attacks. So many remedies must have been tried based on totality or else, but no results. So definitely, this is what I am thinking, that some remedies might have been tried, the lycopodiums and other remedies. How many times such thing happens in a practice? So many times. So how did this case got cured? This is so interesting, so interesting. And to my surprise, the patient was cured with this drug, Scrofula nodosa. Scrofluria nodosa. Now, Scrofula nodosa, which I know is for Scrofulous constitution. We know it for, or skin disease and other things, tubercular disposition. And I'm thinking for this liver complaint, gallstone, he gave nodosa. How? So while doing my retrospective study, the patient got better with Scrofula. But the question is how and why? While doing my retrospective study, now this is also interesting again, I could not locate this drug in Boger synoptic key. I could not locate. There's again strange. Now, this is a case which I got from, of course, Shashikant Tiwari's book. He's talking about Boger, but I could not get this remedy itself in Scrofula nodosa. Remedy itself, the Scrofula nodosa remedy, I could not locate in Boger. That was really strange. So what does that mean? This makes us understand that there must have been many remedies which Boger couldn't add in his MM. And that is why in the preface, the first forward he writes, where he talks about art and druggery, he talks about that more reference tools has to be used. In the first paragraph only he has said. Now we get excited with this concept, like suppose no Boger, and we get stuck to it. That is a problem. So we have to always be open mind and look for symptoms have to be found, whether in Boger, whether in Nair, Clark, we have to use different modes. Then you will become a good physician. They are called masters only because they have no boundaries of their knowledge, not limited with their knowledge. We sometimes get limited with our knowledge. We try to fit the remedy. They will not try to fit the remedy. They will search the remedy in source books. Let us understand the case and break our limitations of knowledge. Let us do that. Please read case again and find out what. Out of all the symptoms, which one is the most characteristic symptom? So when I looked again, read the case, you can go back and read the case. I started asking which is the symptom which is out of place completely. Like, it is a gallstone case. I'll give you an answer. I'll give you a hint. It is a gallstone case. Okay, no problem. Now, if you see 10 gallstone patient, liver affected patient, all will have some symptoms, right? All will have, like, there are many symptoms which many patients of gallstone will have. What this patient has, which no other gallstone patient will have. So the symptoms that we have taken, all these symptoms repertorized. Maybe foot heel pain is something characteristic, but other symptoms that we have taken, a lot of symptoms might be there in other gallstone patient. So what is the most outstanding, strange, rare, peculiar? It is out of all the symptoms, which one is characteristic symptom? Elements from location. So location. Patient says vertigo felt in vortex. I told you, right? I don't know how to take it, but now I understand. Patient will come and say, I get vertigo. He will give you modality, standing, this. But he says, something happens here, when I stand up now, oh, I feel something in the vortex. This is strange. This has nothing to do. I don't know. This is so strange, so strange. Of course, liver can be one of the part, but location, why only vertex? So vertigo felt in vertex, location. This is number one characteristic. So what I did is, I looked as a single rubric, vertigo felt in vertex. And there I found scrofula nodus. I have done this a lot in my practice where I don't find remedy matching with brutality. I've done this in my practice many times where I will look at one characteristic, strange, peculiar symptom and go and look in repertory, only that rubric. And all the remedies which are cited there, I will try to analyze only those remedies if it is matching or not. And many times I have succeeded a lot doing this way, not forming totalities. So not always you have to form totalities. Sometimes you have to smart enough and one or two rubrics, the most important one. And then everything what is patient is saying, you will see it is matching in Mater Medica because last judge is our Mater Medica only. But if you remember, there was certain concomitant also. Vertigo with drowsiness. Vertigo with drowsiness. So he gets vertigo and there's a lot of drowsiness. Now this concomitant symptoms generally you will not find in synoptic key, basically. Few places might be, I have not seen yet. Maybe I have to study more. But concomitant you can find a lot in Boger Bonninghausen, BBCR repertory. So it is said modalities are very important, but if you get concomitant symptoms and that is cited in the remedy, Mater Medica, then that is the most important symptom. You can just prescribe the remedy on that basis. So I started asking myself, vertigo and then drowsiness. Out of these 5 remedies, all remedies have something to do with vertigo. But what about drowsiness? Which remedy has drowsiness? So I read all the remedies from MM, matching the pathogenesis and the symptoms. Excessive drowsiness. I got in scrofula. Excessive drowsiness. Pain, soreness, liver with its all modalities. What are the modality? Lying on the right side, etc., etc., etc. So let me show you in Boric. You go in scrofula, it is said vertigo felt in vortex greater than when standing and dot, comma, drowsiness. It is written in one line. This is the most characteristic. Abdomen pain in liver on pressure. I never thought that scrofula is a remedy for liver. I'm telling you. This is what he said. Now his liver is sore. We have taken a rubric. Now seen Mater Medica. Sleep chapter you go, it is written in bold, great drowsiness. Now we know there are some remedies for drowsiness: opium, entimtart, gelsemium. These are some great remedies for drowsiness. But scrofula can be great remedy for drowsiness. Aggravation worse on lying on right side. Our patient, so he had all right-sided complaint: foot, heel, liver, and lying on right side. So that's how it matches. So this was an interesting case for me. I learned a lot from this case. What is a learning? Learning was when you go in Bonninghausen, right? Just a minute. When you go in Bonninghausen, not Boger, Bonninghausen repertory, BBCR, Boger Bonninghausen repertory, same rubric, vertigo. In vertex, there are 10 remedies. So in Boger synoptic key repertory, there are only 5 remedies. But if you see here, 10 remedies and our scrofula is 2 marks. Patak scrofula is not included. Okay, that's it. If you see Patak repertory, na, vertigo, vertex in, scrofula is missing. So none of the repertory, what I'm trying to show you here is none of the repertory is perfect. You get, suppose somebody solves this case and says, I'll look in Fata. These 4 remedies are there. You go and read in the Mater Medica, the drowsiness thing, the liver sensitivity, everything, whatever patient is saying has to be written in Mater Medica. Not your thematic thing. Oh, calcari is like this, childonium is like this, the dreams and delusion, anger, nature. No. If you really want to have a solid prescription, it has to be written. It has to be written in Mater Medica. So idea is to first find the most characteristic symptom, then locate in repertory, but don't depend on totality and rubrics always alone. Explore. So why are we doing these things? Like Boger I have picked up. Earlier I had picked up Burnett. Maybe next, once I finish this, I will talk about Kent, Nair, Clark. I use it. All repertories I use it. And to my surprise, many times like this important symptom is there, I take it in Nair, I take it in Clark, I take it somewhere else, Boric sometimes, and then remedies are completely different. Okay, they can say you combine everything, but how much can you keep combining? We have to develop a knack of becoming clinician. Our mind has to play in the words of remedies, not in the words of rubrics. Rubrics can be found easily, but in the words of remedies, the remedy differentiation has to go. Your ultimate choice is Mater Medica. Always remember. So totality of symptom has to be found in Mater Medica, not in repertory. Even if in repertory you find totality and it is not matching what is written in MM, then discard the remedy and search for another rubric. You can highlight this last sentence and keep it with you. This is only way we can enrich our knowledge and help more suffering individuals towards cure. So great, guys. It was a short talk, which I just felt like sharing with you. These are my learnings, and this is how I learn. I try to enhance my knowledge, reading different sources and reevaluating, reanalyzing, going back into the case and trying to solve it by myself. And you can also start doing this. See, we are blessed. I'm telling you, we are blessed. Why? Because we have got softwares. This software makes life so easy because you can search anything in your entire Mathematica and rubrics. Any combination you want to search, everything. So why not use this tool and try to get our information and knowledge and enhance the mental faculty faster? Why we want to wait for 10 years, 20 years to become a good clinician? Why we can't become 4 to 5 years a good clinician by solving so many cases? In clinics, you're not getting cases, no problem. But in literatures, there are so many cases. Why don't we pick up? Why don't we start studying by ourselves? Why we want to depend on others who come and show us something and then we will learn? Of course, we take inspiration from others, but a real person is when you take inspiration, but you start reading yourself. Until unless you will start reading yourself, solving things by yourself, your mental faculty will not depend. Or else you will keep remembering and depending on others to give you solutions. We have to find out solution because when you are sitting in your clinic, the only person who has to give solution is you yourself. So thank you very much. Looking for your comments, and next video I'll be coming with the clinical cases. Two cases I'll share, and after that I'll be sharing a lot of practical cases from my own OPD. Thank you very much.